Hey, hi everyone. Thank you for attending our webinar. Today's webinar is titled Unpacking the Pillars of the IPHCC Data Governance Framework. So in today's session, we will be delving into the complexities of the data governance framework that IPHCC has been working on, understanding its visions, principles, and structural elements, and its importance for Indigenous data governance in Ontario. We will also be discussing the indicators and key performance measurement concepts to support the implementation of the framework. So this is a brief overview of today's agenda. We're going to begin with just a brief overview of IPHCC for anybody who isn't familiar. Next, the data governance frameworks and principles, our implementation plan for the framework, the key measurement concepts and indicators, and then lastly, the next steps. So about the IPHCC, the Indigenous Primary Healthcare Council is an Indigenous governed, culture-based and informed organization. Our key mandate is to support the advancement and evolution of Indigenous primary healthcare services throughout Ontario. So the way we do this is through four main ways: empowering the voices of Indigenous peoples and communities to affect change, partnering with Indigenous communities, mainstream health organizations and government agencies, gathering and sharing data about the health status of Indigenous peoples in Ontario and the inequitable service gaps, and then finally, equipping IPHCC members with the tools, training, and networks to provide quality healthcare. So this is a map of IPHCC's membership throughout Ontario. We currently have 22 members that are made up of Indigenous community health centers, Aboriginal health access centers, family health teams, nurse practitioner-led clinics, and Indigenous interprofessional primary care teams. So our model that we base our work off of is the Indigenous Health in Indigenous Hands. So this is a holistic model for Indigenous health and well-being that integrates traditional knowledge and Western medicine and healthcare services, recognizing the interconnections between physical, mental, emotional, and spiritual aspects of health. In Ontario, IPHCC has developed a holistic health and well-being model that emphasizes the importance of the traditional knowledge and practices as well as the collaboration with Western healthcare providers. So by adopting this holistic approach, we believe that healthcare services can better address the unique health needs of Indigenous communities in a culturally safe and effective manner. So bridging the gap. So understanding the value of data and the people to whom it most affects, we look at the frameworks which protects Indigenous FNIM data sovereignty on every level across health systems, people, communities, and nationhood. So we adopt a two-eyed seeing approach to data where we look at data from both traditional and Western lens and also from a local governance and provincial oversight approach. So Marlon will be talking about our data governance framework and the principles.
All right, thanks, Prab. Hi, everyone. Thanks for joining us today. So looking at the overview of the data governance framework, the principles, and what is really that we're going to be doing. Over the past 2 years, we have been working on a data governance framework. And this framework saw us engaging with our members, trying to understand what value it is do we see having a data governance framework? What are some of the tools that are necessary and that what we would need in the sector to represent Indigenous data? Do we have the systems out there? Quite frankly, no, we don't. We don't have enough systems to capture the Indigenous data to tell the story that we want to tell. And thus, by creating this data governance framework, it then allows us now to articulate the gaps that we see. All right. Before we go any further, let's start off with a poll just to kind of get everyone excited and engaged. So if we can just have our first poll question here. All right. So the overview of the data governance. Question number 1 is saying, have your organization adopted or developed specific Indigenous data governance principles or guidelines? So we have different guidelines based on the different groups, Indigenous groups that you may be a part of. We have the OCAP, which a lot of persons, this is the more popular one. We have OCAS, and we have IQ from the Inuit, understanding some of these principles. And as we go down a bit further, so yeah, we're getting some responses here. 53% so far has said that no, they don't have or they've never developed a specific Indigenous data governance policy or guideline, which is good. It's good that we have this data, and we're going to close the poll in. So let's just talk about the results real quick before we go any further. 27 said yes, 27% said yes, 55% said no, and we had 18% preferred not to say. So now the first step is on our journey is to identify what do we really use data for, and how do we use it in the Indigenous primary healthcare sector. And quite frankly, based on our model as our core, right? Our model informs everything that we do, the model of holistic health and well-being. Looking at culture, culture speaking to research. What effects does research have on the Indigenous culture historically? So we have to look at that too and have that accountability within the Indigenous communities, and IPHCC looking at having Indigenous health in Indigenous hands. And when we look at research here, we use data for advocating for our members, funding proposals, policy development, you name it. We're using the data to speak on behalf of our members in a form of advocacy. We also use data to improve the health outcomes of the Indigenous population. How do we collect it? We track it, we monitor it, and then we analyze the KPIs based on what our members are saying. Now, we want to take it from a position of strength, looking at the positive than a deficit-based approach. And that's how we analyze the data. And that's the spin that we want to put on it. And then as we go down further, we're going to see more in our principles and taking a look at the framing. How do we frame our principles, right? From a positive lens, rather than looking at it from a deficit-based approach. We also use data for quality improvement and evaluation. We use it to inform the programs. The reality is that we don't get a lot of funding in some of our programs, and thus, in order to tell that story, we need to then now evaluate and then now show the quality. We need to now look at research. We need to look at advocacy. But one big thing that we use data for is telling stories. And sometimes when we hear data, we don't even realize that data is not static. It's not just all these different things that we're seeing here. We have the knowledge and the experiences, or the lived experiences, which forms the data. We have the personal experiences. We have the culture, the language. That's data as well. And then now we have the administrative data, where we're using evidence-based approaches, such as like the SAMI scores or the practice profiles that we have a few members that sign up for. But we have to tell the story. And how do we effectively tell the story without understanding what it is that we're using the data for? So part of our framework looks at the type of data that we're collecting, how we're collecting it, and who is involved in it. Now, if we're going to break down what the framework looks like, we have to then understand the different elements of IPHCC and what did we look at to inform our approach for developing this data governance framework. We had to then now look deeply and analyze to say, hey, you know what? It's important for us to have the vision, what it is that we want to do, and our principles. Now, most principles that we're seeing out there, OCAP, OCAS, IQ, they are specific to an individual group. And yes, different groups can take different insights from these principles. But when we're looking at our principles, we have decided that we're going to get some inherent set of principles that our members deem to be important. Now, looking at the strategic elements, the framework, and this is going to be used as a guide throughout the sector. Or governance structure. What builds up the governance structure? Who do we look at? Or what body governs Indigenous data, right? How do we look at it? Now, in IPHCC, how we've defined our governance is from a macro lens, from a meso lens, and from the micro lens. And if we were to internalize that to simplifying it, we have our federal partners, our provincial partners, and our members. Our members are at the core of what we're doing. Understanding the governance, how do we hold these different pillars accountable? What policies and procedures that we put in place to ensure that we have Indigenous governance in the hands of Indigenous people? What are the privacy and security policies or guidelines that we have put in place? Now, privacy and security is one important one as it relates. It goes hand in hand with legal instruments, right? When we're talking about our DSAs. So we have been in dialogue with our legal team we have an Indigenous legal team. And when we're talking about Indigenous health in Indigenous hands, we have to look from, we're taking a holistic approach, not just, okay, we're getting a non-Indigenous law firm to get the legal instruments done, or DSAs. We want to take a look for persons who have these lived experiences, that understands the data, that understands the people that we're trying to protect and preserve their sovereignty. Now, so privacy and security policies, in my eyes, I'd coin them together in the legal instrument, because then it helps us understand who has access to this data, who gets to see our data, and what happens in these legal instruments is a mere reflection of the privacy vision that we have for the sector. Then we have the research and ethics. How do we look at ethical considerations to data governance and to data, conducting research in a good way and holding persons accountable for the data that they collect from our sector? Now, as I spoke about the different pillars, this just gives us a graphical representation of that data. Looking at the federal, as I said before, organizations with the federal-wide jurisdiction that has responsibility related to ensuring that Indigenous data governance is adhered to. Then we have a lot of meso partners, right? We have a lot of provincial partners that our sector, we work with. We work with MOH, and this is just giving you like quick and dirty way of looking at how we view the governance pillars for IPHCC and our sector. All our members, we have provincial partners that we work with, and if you're a part of an OHT, you will possibly be at the provincial layer as well, right? And then interfacing with our members. And as we realize here, our IPCOs, our Indigenous primary healthcare organizations, are at the center of our approach. But before we go on to our next slide, let's pull up another poll question right here, so just to get the audience engaged. What level of governance does your organization fall into? Are we in the macro, the micro, or the meso? Let's get some sense of where you're coming from. And if you don't know, that's fine. So we're having a lot of meso level stakeholders at the table right now. All right. So as we're seeing here, we have federal partners, and we have 4% federal, 56% provincial, and we have 19% for our members, and that's good. We're hoping to get these numbers increase as we try to display some of the tools that we have and the products, but that's fine. So speaking of principles, we've been trying to identify the best principles. Like for me, when we were trying to find the principles based on what we got from our members, we were trying to find principles that would be simple and easy. I was trying to find something that was simple and easy, but when we put it together, it wasn't as short as I wanted it to be. SOS is a call for help. Usually we hear SOS as a call for help. And the first S that we have here, and we initially called it stories of strength. I started off with stories. And then, but the reality is that everything that the Indigenous population does and how they share data, or they transfer information from one to the other or through generations, it's through stories. I'm telling a story right now about what happened to my family back in the days. But one must feel a sense of safety when we're dealing with Indigenous communities, organizations, partners, etc. And this is how we want to take a look at it. And we're going to then now see the implementation plan for how it is that we intend to have these principles adopted and implemented, not only by our members, but our federal and provincial partners. But then we look at trust, and I'm just going to go over stories because I know that there's a lot to go over as it relates to our implementation plan and the indicators. And a lot of persons are here to see the indicators and what those mean. But trust is a big part of what we do in the Indigenous advocacy world, because the reality is that if the Indigenous population cannot trust the partners that are a part of each pillar, there can be no engagement. Engagement is one big piece. Who owns the data, right? Members will be supported to claim and own their truth when sharing data and information. How can we support members and Indigenous partners to be able to own their truth, own their data when it goes into the data domain? It's their data. Relationship centrism. Systems, policies, and processes will be designed to build and maintain respectful and reciprocal relationship with members and partners. I mean, this isn't stated enough, right? The reality is that there's hardly any system there to build this relationship that we're looking for. And it is our responsibility, and persons that are listening to my voice right now, I encourage you and I implore that we need to ensure that equity is there for Indigenous partners, because the reality is that the playing field isn't leveled. We need to create this relationship. Then now we have impact awareness. Data governance will create the process that support and strengthen our members and whose communities can be impacted by the words and the actions of others. The impact. Then we have excellence. Then finally, we have strength building. Now going deeper down now, we're looking at how do we nurture and build strength of our knowledge keepers and our traditional culture. I'm saying or the Indigenous traditional culture, please forgive me. How does that happen? How do we build and from a strength-based perspective, build on that tradition? Do we look at cultural safety training? Do we look at having these mandates and these respective call to actions, but looking at tradition as one, the traditional medicines? How do we look at, just looking overall on the Indigenous culture? How do we support building strength and getting that data to support that strength building? So now it's stories of strength, but you'll see all this in the presentation that will be shared afterwards, optimism and framing, right? Now, I said I won't go into optimism, but I'm just going to touch on optimism as my last point before I transition over to Kristen. But how do we now change the narrative or do the framing that we're no longer looking at data from a deficit-based approach? Because this further enables the challenge and the gaps that we're facing, right? Because then we're looking at, or the Western world would then now look at data or project the data for the Indigenous population from a negative-based standpoint. Now, our principle seeks to change all of that. We want to take a different approach and a different framing approach for optimism. We want the stories that are shared in a more optimistic frame. Inuit, First Nations, and Métis. Final slide for me, and data sovereignty. How do we look at data sovereignty? And initially when we heard Prab mention bridging the gap. In order for us to bridge the gap, we have to look at two different approaches. One, the Western approach and the traditional approach, and it's often called the two-eye seen approach, right? So now how we define sovereignty is merging or amalgamating the Western and the traditional approaches to develop this one model or this one framework, right? So we define sovereignty in 4 Ps. One, partnerships. On the left side, we have the traditional approaches, and let's dive deeper into the traditional approaches. We have the partnerships. How do we do that meaningful engagement? Can we do meaningful engagement? Will Indigenous organizations be open to having that meaningful engagement with your entity? If you're Indigenous or non-Indigenous, how do we bridge that gap and have those engagement in? Right? Formalized partnerships agreements. This can be done through how do we evaluate that one partner is satisfied by using these agreements and putting these in place? Are we bringing the right persons to the table if we're having our projects? Are we consulting with our partners? Don't wait until it's too late to consult with your Indigenous partners. Consult, engage, right? Now, if we're gonna now stay on the left side, and we're seeing on the screen the personal experiences piece, this is the lived experiences, and it gives that counterbalancing effect for supporting the intended outcomes for the respective Ps. But this one is so crucial because we have to look at the person that's there, that's involved, the client. This is so absolutely important. Yes, we're seeing sovereignty, but the reality is that what are we protecting? And in the realm of the primary healthcare domain, we're looking at client data, and we're looking at the stories. We're looking at preserving and safeguarding the stories from the personal experiences, from the people that matters the most, the people that are bringing their stories, their fragmented stories, because then it's important to note that the stories that we collect on behalf of our members or the sector is just bits and pieces in time. It doesn't reflect the entire story of an individual personal experience. So that one is a disclaimer that I'd always say. All right, one client bringing data to a healthcare, they self-select to be going into one of our centers, but the story that they come with, they may have a chronic disease. That is just one aspect of their life, and it doesn't reflect the entire story. But if we go over now to the Western approaches, and this is where the crossover comes in, we look at the policies, developing policies for our members to strategically move and create that accountability for our data governance approach. And finally, with policies, naturally, we have to have the processes. What kind of processes do we have to hold our partners accountable? The research process. I've seen a lot of non-Indigenous partners and allied partners and the government as well develop different processes that deals with Indigenous data. How do we effectively do this? All right. How do we create indicators? And then as I speak about indicators now, I think it's a good time for me to now move over to the third part of our discussion, which speaks about how do we plan to implement these principles, looking at KPIs and indicators. So without further ado, ladies and gentlemen, I hope you learned a lot from this section. I'm going to turn it over to Kristen right now and then allow her to introduce herself. Thank you so much.
Thank you, Marlon, and thank you, Prab. I hope the volume on my setup here is appropriate as well. Please let me know in the chat if you're not able to hear me, and I'll do my best to adjust things. But my name is Kristen Cathervelu. I'm a consultant, and I'm working with the IPHCC on the implementation of the Data Governance Framework for this fiscal year. So Marlon had mentioned that this data governance framework is the result of many years of consultations and conversations between the IPHCC, its partners, and its members. And this year, what we wanted to work on collectively is a way to provide members and partners with tools in order to enact appropriate data governance within their own organizations. So that consists of three parts in particular. So of course, continued development of the data governance framework itself, and in particular, an indicator framework. And the purpose here is to provide a way for organizations to implement and evaluate how well their internal data governance initiatives are doing. Secondly, we are developing some policy and procedure templates, with which Marlon alluded to as a component of the larger framework. The purpose here is to provide policy and procedure templates that can be customized by each organization that wants to use this tool to ensure that appropriate Indigenous data governance principles are being followed. And thirdly, we're going to be developing some data sharing agreement templates. And the purpose of this piece of work, this stream of work, is to create some agreement templates that outline the accountabilities of various parties, specifically with respect to sharing data. And we want those, again, to be customizable for use by organizations. So As you can imagine, the development of these types of resources is very complex. It's very iterative work. So when we, in particular, look at the development of the indicator framework, we've already started that work. So back in June, we engaged stakeholders and partners at many different levels of the system. So when we went over that slide about the pillars of governance, the micro, meso, and macro, we worked with a group of participants to identify some potential indicators aligned with the two-eyed seeing approach, aligned with the 4P methodology, the key here being a very balanced approach. And so that work was done back in June. This fall, we're going to take those preliminary lists of indicators. We want to hear more feedback from members, from partners about those indicators. We want to develop some indicator specifications and talk about the language of what's being measured in more detail. So continued consultations are happening this fall. And the anticipated timeline for the indicator framework to be available will be in winter 2024. So that will be, again, a component of the framework that will help with its implementation as well. So lots and lots of engagement planned in order to finalize that component of the work. So engagement to date, I mentioned that June webinar. At that webinar, we had about 30 to 35 participants. What we did was we facilitated some small group discussions regarding a list of preliminary indicators. And we asked the participants to provide us with feedback at the session, kind of yay or nay, should this indicator be included or should it not? And of course, we provided some recommendations and some things to take into account during that decision making. Following that session as well, we did administer a survey where participants were invited to provide additional feedback about the indicators and about the process as well. So I'm going to provide you with some of the feedback that we did receive at that June 26th webinar. But before I do, I wanted to share, I did allude to the fact that there was some context set and some recommendations for things to take into account decision-making wise, whether those indicators were going to be recommended or not. The IPHCC keenly recognizes that its members and its partners and organizations at all levels of governance are in different stages with respect to implementation of appropriate Indigenous data governance. What the IPHCC wants to be able to do is to meet persons, to meet organizations where they're at, and to be able to provide tools to further those principles being implemented. What we recognized in our conversations with our partners leading up to the development of the indicator framework is that organizations who have a good sense of cultural safety are already really well positioned to enact Indigenous data governance within their organization. So we consider, when I review the feedback that we obtained, we are considering cultural safety as a key foundation with respect to enacting data governance. So as it's listed on the slide here, organizations who embark on journeys of respectful engagement with the purpose of recognizing and addressing the power imbalances that Indigenous people face when interacting with the healthcare system. So that's sort of the official definition of what cultural safety is, are really in a good position to enact data governance activities. And we wanted to be able to acknowledge and celebrate and profile that in the indicator framework. So further to that concept and to my comment about the IPHCC being very aware that organizations are at different levels of enacting data governance individually, we created what we're calling a spectrum of data governance maturity. And it's divided into 4 phases. Again, these slides are going to be shared, so I don't want you to get too bogged down with details. But if you had to know, 3 or 4 things about this slide, it's the 4 phases that are outlined here. So an organization at phase 1 of maturity, again, is recognizing that cultural safety is important. It's working to develop and implement policies that support Indigenous persons. A phase 2 organization, we call this the planning phase. They've made a commitment to providing culturally safe care to Indigenous persons. They're beginning to engage in discussion. So we start to see here, not only are there policies and processes, but also engagement, conversations, partnerships, and personal experiences are being taken into account, those second of the 4 Ps. And then they're starting to have discussions with Indigenous persons and communities about the appropriate governance of data. A phase 3 organization, we're calling that the implementation phase. An organization in phase 3, we envision as being actively ensuring, ongoing cultural safety and well-equipped to ensure appropriate governance of Indigenous data. So they have all the pieces in place and all the tools in place. And then there's also a phase 4 organization. So they've been at this for a while. They're at what we're calling an optimization phase. They've fully implemented Indigenous data governance principles, policies, and now they're working at continually refining, improving, and working on their Indigenous data governance practices. So, pardon me, with this slide still on your screen, we're going to launch our next poll. And I know the poll is probably going to block the slide. So before you answer, I just want you to know I'm going to be reading off the definitions that we went through. Just give me one moment here. So what I want to hear from you is what phase you feel your organization is at with respect to data governance maturity. So phase 1 organization recognizes the importance of cultural safety, and it's working towards developing and implementing policies aimed at addressing health equity considerations for Indigenous people. Phase 2, we call that the planning phase. Your organization has made a commitment to providing culturally safe care and is beginning to engage in specific discussions with Indigenous communities about appropriate governance of Indigenous data. Phase 3, the implementation phase, you're actively ensuring ongoing cultural safety and equipped to ensure appropriate governance of Indigenous data. And then phase 4, the optimization phase, you have fully implemented and you're continuously improving your culturally safe care and Indigenous data governance practices. The majority of participants today are affiliated with organizations in the awareness phase. So very much at the beginning of their journey with respect to data implementation, may have implemented some great cultural safety initiatives, but still trying to learn more about that data governance piece. So 7 of the 24 persons who responded, about 30%, are in the planning phase, and about 8% and 4% each so 8% have said they're in implementation. 1 organization in optimization, that's wonderful. And then 1 person, wasn't quite sure, either wasn't sure or preferred not to answer, which is fine. Sometimes we're in between. Nothing's ever discrete. We try to make these categories for the sake of presenting these complex ideas more simply, but sometimes you just don't fall into one. So that's fair as well. Some of the key measurement concepts here. So here are the indicator. So the 4-eyed, Prab alluded to the 2-eyed seeing approach to data. So incorporating strengths of the Western and Indigenous-based approaches to data. And so what we did is we presented our indicator framework in alignment with the 4 Ps that Marlon presented earlier. And just as a reminder, what those 4 Ps represent are policy, processes, partnerships and personal experience indicators. And I'm sure, as you can imagine from where you sit in your day-to-day work, the policy and process domains are very much aligned with a Western approach, speak to the existence of policies and processes in order to ensure that these important concepts are enacted throughout an organization. The partnerships and personal experiences domains are very much counterbalancing domains, strength-based approaches that speak to not only whether policies and procedures exist, but whether they were developed with the right degree of conversations and partnerships, and whether they're taking the personal experiences of Indigenous people and of providers into account as well. So I'll go into this just a little bit, but the policy indicators, again, this is all going to be circulated, so I don't want you to get too bogged down with details. Ensuring that policies are in place and ensuring that all the components are in place for guiding data collection, analysis, interpretation, and release of Indigenous data and research. Process indicators speak to the same types of, I think, concepts. So whether there's an actual process in place to do exactly the same thing as the policy indicators. Partnership indicators determine whether the right degree of relationships are in place with Indigenous people, with Indigenous communities, but that's represented by that organization's client population. As opposed to saying whether or not partnerships exist, we also want to speak through these indicators as to whether meaningful engagement is occurring. This partnership indicator domain also speaks to the existence of data sharing agreements. And you can imagine, based on where an organization is in terms of the spectrum of maturity, one or more of these descriptors may be met. And so it gives you a sense of where you want to be and where you are right now. Finally, with the personal experience indicator domain, recognizing and ensuring that Indigenous persons feel safe and respected while receiving care. This is the ultimate goal of all of this work. We can talk about data governance, we can talk about policies, procedures, but if people aren't feeling safe receiving care, if they're not feeling safe disclosing their personal information or feeling listened to, then it's all for nothing. And again, it's why it's so important that we include these counterbalancing indicator domains, the partnerships and the personal experiences in our indicator framework. We also want to ensure that Indigenous persons are feeling confident sharing information and that providers are feeling equipped to provide the type of culturally safe care that Indigenous people deserve when they interact with the healthcare system. So hopefully that gives you a sense again of where the entire framework was going as a whole and the alignment with some of those fundamental principles that we reviewed later. The next few slides I want to go through fairly quickly because we do have some polls that we want to administer to get your feedback on what we've presented today and your ideas as to what supports we can provide to enable your own data governance journeys. But here is, again, just a brief summary of the indicator feedback, the feedback on the indicators that we presented at that webinar on June 26th. So you'll see in the left-hand column, there are 5 indicators. And in the most right-hand column, there's an inclusion recommendation. Again, that's the left and right-hand columns are kind of boiling the ocean. If all you needed to know is whether participants either recommended or did not recommend inclusion of that particular indicator in the framework, that's all you need to know. We also included some overall feedback about each measures, so you can get more information. Here are the process indicators. So very much what you'd expect. Whether there are processes in place within organizations that embed considerations for Indigenous clients, for example, whether there are defined structures that exist, policies that exist, and or data governance processes in place. And you'll see in the right-hand column that the feedback did vary quite widely depending on the indicator and the rationale that was presented, but lots of great feedback that I'll talk a little bit more about at the end. Our partnership indicators were a little bit more varied. varied. We wanted to, the ones that we suggested were, whether the percentage rather of Indigenous communities that had been engaged with respect to developing policies and processes, Indigenous representation on a governing board, retention rate of Indigenous representation on governing boards, and for data sharing agreements, more specifically, the percentage of Indigenous communities who had signed an agreement. And this is the list of personal experience indicators. Again, they vary widely. So percentage of Indigenous clients who reported experiencing racism in a healthcare interaction, the percentage of Indigenous clients who felt comfortable asking questions or expressing concerns, the percentage of Indigenous clients who felt respected and that their culture and culture and traditions were respected. Those who felt comfortable identifying as an Indigenous person, the percentage of Indigenous clients who felt that their medical information was confidential, and the percentage of staff who reported a good or excellent level of knowledge and cultural safety. Again, our providers are important when we start to look at all those different methodologies. We want to make sure that our providers are represented in them as well. So I have another poll to administer, but it's another one where I'm going to have to read off some definitions while you're responding to it. Okay, we'll start with this one then. I'm sorry, I thought it was going to be a different one, but I wonder, again, from where you are and your organizations are in their data governance journeys, what additional resources we would find useful or you would find useful to support your efforts. So we talked about the data governance framework. We talked about the indicator framework. We're developing policy and procedure handbooks, community of practice, informational webinars. From our June webinar, we did hear from participants saying that some support from the IPHCC, specifically with respect to data and research requests, might be helpful. And then I also want to invite you to use the chat box to list any additional resources that you feel would be helpful to move you and or your organizations along in their data governance, Indigenous data governance journey. So hopefully everyone can see that. The indicator framework seems to be something that people are very interested in. The policy and procedure handbooks, the framework itself, a community of practice. Okay, a couple of people think that that might be helpful so that maybe organizations can share their experiences and their journeys. One person indicated that informational webinars might be helpful. Emily in the chat is saying that there are very unique scenarios that various levels of government experience. I can imagine that. Aideen is saying data sharing agreement examples, templates. That wasn't included in our poll, but yes, that is something that's being developed as part of our work plan for this year. Oh, thanks, Andrea, for that. Oh, that's a great point. People might have wanted to select more than one and not had that option. So thank you. That's a good point. That's a really good point. We may send out a post-session survey in that case. Curtis, implementation aid, boots on the ground to help initiate and train quids on this work. That's great. Aideen agrees that a multi-select may have been more appropriate for this question. Thank you for that, Aideen. So we can close this poll and I'll just take us through our last slide in terms of next steps with respect to the indicator framework specifically. So this fall, I did mention that we're going to be continuing to refine the indicators. We're going to be developing indicator specifications and developing those policy and procedure handbook templates. Over the course of winter 2024, continue to work on the specs and then obtain feedback on the policy and procedure handbooks from partners. And then we are hoping that in the spring of 2024, the final governance toolkit will be available. So that will consist, of course, of the actual data governance framework, which I'm sure you can understand is an evergreen document. We're continuing to have conversations and consultations, learning and growing and evolving that document as we learn, and as well the policy and procedure handbooks, the indicator framework, and the data sharing agreements next spring. So we have a few more polls. I hope we have enough time to get through them all, but we can do the next. This is more of a out of interest, but I wonder, based on the 4 Ps, so the policy, processes, personal experience, and partnership domains, which I will read descriptions of, but wanted to kind of understand which of those 4 domains you feel from your perspective in the system would be most helpful with respect to implementing data governance. So policy indicators speak to the existence of policies that hold persons accountable or parties accountable for Indigenous data. Process indicators, they're used for accountability. They're used to ensure that policies are being implemented as designed. Partnership indicators, they are meant to assess whether engagement with communities is happening to ensure that their interests are prioritized. Formal partnerships agreement can be one component of that as well. And then, of course, our personal experience domain, those indicators speak to the lived experiences of Indigenous persons and providers. And they give us a 360-degree view of whether policies and processes and partnerships are supporting their intended outcomes, which is the safety of Indigenous people. So again, about half, 18 of 30 participants have answered. And again, we know that all 4 Ps are important. They all counterbalance each other, but just wanted to understand whether participants today had 1 P resonate more strongly with them than others. So we're at about 19 participants. I think we can stop this poll just to make sure we get through the rest of them. And hopefully you can see the results. So processes and personal experiences. So 6 participants each felt that those resonated the most with them. And then, of course, partnerships was another strong quadrant, and policy. 2 organizations felt that that was an important domain. And again, we recognize the importance of all the domains and the different functions of organizations at different levels of the system. Some are more compliance-based, so that's very interesting for us to know. A couple more, last 2 polls, but we wanted to ask you to rate the usefulness of the information that we shared here today, if you're willing to do that, just to help us continue to refine the information that we share at future webinars. We'd really appreciate your feedback there. I think most persons felt it was either very useful or extremely useful. There were about 3 organizations who maybe didn't find it as useful as they would have liked. And we do encourage you to email the panelists afterwards and share your thoughts and feedback in a more detailed manner if you're comfortable doing so. Again, in the spirit of helping us refine and improve for future webinars, we'd love to hear from you. And final poll. This one is about future topics. So I know informational webinars were only cited by a couple of people as being like the preferred way to get information out there. But if we were to do a few more, what topics would you like to see covered in those webinars? So this one is a short answer question, evaluation, this type of information presented through case studies and examples. That's excellent. And then strategies in general, it looks like, to collect information on minorities. Okay. Well, we'll have to do a little bit of interpretation, I think, for some of these responses, but very helpful for us to know. Again, thank you for sharing your thoughts. I mentioned that there is going to be additional engagement that's happening over the fall where you can share your thoughts on the indicators, but I wanted to thank you all. I'm sure Marlon and Prab agree. We're so thankful that you could be with us today, and maybe I'll leave it over to you, Marlon, to give the final farewell.
No problem. Thank you so much, Kristen. Job well done. Thank you guys for joining us today. For the persons who spent your hour glued in, I can tell that the engagement rate was high for the persons that were here. We can see this through the polls too. But I really want to thank you guys. If you do have any questions, feel free to shoot us an email at communications@iphcc.ca, and that information will then be filtered to the panelists. And again, thank you so much as we move forward with having our data governance framework and our toolkit all set so that we can share with the wider public. We thank you for being here with us today. And until next time, ciao guys.